Hello everyone, I'm Radhika TH and my register number is 22 MTLA40. So today, me and Nandini, we both will be talking regarding brisk walking. So one of the easiest way of ensuring that you stay fit and healthy is to go for a walk regularly. So walking every day has several health benefits. So what is the difference between walking and brisk walking? So when we say I'm going for a walk, it could have mean at any pace, slow, moderate, or fast. Theoretically, brisk walking refers to a walking speed of 3 miles per hour. Brisk walking is a more effective version of walking. It is a walking at a pace driven by your metabolic rate to effectively achieve fitness as well as health. So anything around 100 steps a minute can be considered brisk walking as it varies slightly from person to person. So it is very convenient, affordable, and accessible for people of all fitness levels to ease themselves into a more active lifestyle. So a daily brisk walk can significantly benefit your mental as well as physical health. So physical activity doesn't have to be complicated, suggested a yoga instructor as well as martial arts teacher from Thailand. Walking at a brisk pace, even for just 10 minutes at a time, is one of the easiest, most effective, as well as powerful way to keep fit and stay strong in body as well as in mind. And it can easily fit into everyone's life, even on busy days. So now let's look on how to do brisk walking. How fast should you be walking? According to Centers for Disease Control and Prevention in United States, try moderate intensity aerobic activity that makes you sweat and raises your heart rate to the extent that you can still talk but not sing. So, Dr. Sadhra Shraddha, a retired acupuncturist as well as a lifelong brisk walker from Indonesia, she adds up that the key is to maintain a pace that feels challenging, but not so fast that you are left breathless or exhausted. So you are the best judge. And she has suggested 4 ways to gauge whether you are in brisk zone. First one is count your steps. So aim for at least 100 steps per minute. So according to a study published in British Journal of Sports Medicine, use a smartwatch or pedometer app on your mobile phone to keep track of your daily steps. And the second one is observe your breathing. So, a brisk walk should be faster than a stroll. You can tell you are brisk walking if you can hold a conversation and not run out of breath. Third one is keep an eye on your heart rate. As a rule of thumb, brisk walk should bring your heart rate up to around 110 to 120 beats per minute. So this varies from person to person depending on several factors including age, weight, overall health, how often you've been exercising, how fit you are. So seek your physician's advice if you have some existing disorder or health conditions before doing any intense physical activity. And the fourth one is practice good posture. So Dr. Shraddha recommends the following 4 correct posture and walking technique. First one is hold your head high and your chin parallel to the ground, looking forward and not down. Next one is keep your neck, shoulders, and back relaxed, engaging your abdominal muscles. Move naturally. And the next one is swing your arms loosely and freely with a slight bend in your elbows. And the next one is walk steadily, rolling your foot from heel to toe. So now let's look on the necessary precautions as well as the materials that is being requiring while you are doing brisk walking. So first let's look on precautions. So first one is warm up and cool down. So always start your brisk walking session with a 5 minutes warm up and finish with a 5 minutes cool down to prevent injury and gradually raise to lower or heart rate. And the next one is proper form. So maintain a good posture and natural stride while walking. So keep your head up, shoulders relaxed, and arms bent at a 90-degree angle. And listen to your body always. So pay attention to how you're feeling during your walk. If you experience pain, dizziness, or shortness of breath, stop and seek medical attention if necessary. And the other important one is hydration. So stay hydrated by drinking water before, during, and after your walk, especially in hot weather. Other one is pacing. So start at a comfortable pace and gradually increase your spread and distance over time as your fitness improves. Don't push yourself too hard, especially if you are just starting. And rest days. Allow your body to rest and recover. Incorporate rest days in your routine to prevent overuse of injuries. And the other one are safety gear, terrain awareness, traffic rules, and medical clearance. So these are other precautions. Now let's look on to the different materials that has been requiring. First one is comfortable shoes. So always try to invest in a good pair of walking shoes with proper arch support and cushioning. They should fit well and suitable for your specific foot types. Next one is comfortable clothing. So clothe according to different weather, appropriately according to weather. Water bottle. So staying hydrated is very essential. So carry a water bottle to sip on during your walk, especially on hot days. Then sun protection. So if walking outdoors in a sunny condition, wear sunscreen, a hat or sunglasses to protect yourself from the sun's harmful UV rays. Other one is watch or fitness tracker. So a watch or fitness tracker can help you to monitor your pace, distance and time, making your brisk walking sessions more comfortable and effective. And the other one is identification and emergency information. Now let's look on to the contraindications of brisk walking. So there are several contraindications being suggested. First one is severe injury. So if you have severe musculoskeletal injuries such as recent fracture, severe sprain or torn ligaments, brisk walking may be exacerbate the injury or slows down the healing process. So consult with a healthcare provider for appropriate rehabilitation and exercise recommendation. Other few contraindications are heart conditions. So, heart conditions, individual with certain heart conditions such as unstable angina, then recent heart attack or severe heart failure should seek medical advice before starting a brisk walking program. For some heart patients, supervised cardiac rehabilitation may be recommended. Other few contraindication are respiratory condition, recent surgery, pregnancy complication, infections or illness. Infections or illness in the sense if you have fever, severe infection, or any illness that affect your ability to breathe or your overall well-being, it's best to rest and recover before resuming the brisk walking. And the other conditions are balance issues, medication interaction, medical procedure, and finally symptoms. So if you experience symptoms such as severe shortness of breath, chest pain, dizziness, or fainting during brisk walking, stop immediately and seek medical attention.
Hello, I am Nandini Kashikar, roll number 22 MPLA 64. And as Radhika has introduced us with brisk walking and what it is, I'll be talking about the benefits, challenges, prescribed duration, and all of that. So let's see what the benefits are when it comes to brisk walking. So first one is maintaining a healthy weight. So brisk walking helps maintain weight by burning calories, boosting metabolism, and aiding in fat loss and muscle tone. So that's how it helps in maintaining a healthy weight. Next, it helps us improve balance and coordination. So brisk walking primarily engages and strengthens the muscle of our lower body, which can include hamstrings, calves, muscles in the hips and core. So eventually, it helps our body in balance and coordination. Next is it helps in reducing stress and tension. So brisk walking involves rhythmic movement and focused breathing. So both of these activities, when combined together, helps us relax, and it improves blood circulation, and it helps in secretion of endorphin, which is basically a feel-good hormone. So that's how it helps in reduction of stress and tension. Next one is it uh, helps strengthen our immune system. So it supports the efficient functioning of respiratory and cardiovascular systems. So that's how it eventually helps all of us strengthen our immune system. And lastly, it helps us improve our mood, cognition, memory, sleep. So, in brisk walking, there are many brain areas involved. So, one of them is hippocampus, which is linked to memory, prefrontal cortex, which is linked to cognition and decision making, amygdala, which is linked to emotions, and brainstem, which is linked to sleep and wakefulness. So, because these areas are involved and regulation of these areas improve our mood, cognition, memory, and sleep. So, these were the benefits of brisk walking. So, with benefits comes the challenges. So, the first challenge is motivation and consistency. So, consistently staying motivated can be challenging, or like especially for those who struggle to, be in a routine or like establish a new routine. So, overcoming such mental barriers and finding ways to stay committed can be difficult. Second point is weather or environmental factors. So there can be some areas where there can be extreme heat, extreme rain, cold, and all of that. So because of that, this can also be a challenge. And not everyone can afford going to a gym or like using a treadmill for, brisk walking. So outdoor brisk walking can be a challenge for some people. So next point is muscle soreness and fatigue. So initially, individuals may experience muscle soreness or like fatigue because their bodies adapt to this increased physical activity. So proper warm up, cool down, stretching exercises, and all of that can help reduce these soreness or like fatigue. Time constraints. So like not everyone can make time for such activities, or like everyone has other commitments, family, job, and all of that. So because of that, there can be certain time constraints on some people, because of which it can be considered as a challenge to complete the activity. And last is the injury risk. Like any other form of physical activity, brisk walking also carries certain injuries such as strains, sprains, blisters, or like even joint pains. So for this, I think adequate warm up is necessary for the same, or else it can be like very risky or like very challenging. So these were the challenges when it comes to brisk walking. Next, we'll be talking about the prescribed duration. So, according to the World Health Organization and the Centers for Disease Control and Prevention, the prescribed duration is at least 150 minutes per week, which equates to 20 to 30 minutes per day. And this you have to continue doing for 5 days a week. So, it is important to maintain a brisk pace throughout the duration of your walk to achieve a desired intensity. It should be taken care that completing 100 steps per minute is also important when you talk about brisk walking. However, people can, tailor the duration by talking to their health professional, or like according to their lifestyle and fitness. So this was about the prescribed duration. Next is I managed to ask my cousin to share her experience of brisk walking, and she has been into the same for like a couple of months. So let us hear what she has to say.
Hello, my name is Sharvani Deshmukh. I'm 20 years old and a first year BDA student. So I've been brisk walking for a couple of months now. I'm in my college cricket team and my head coach recommended it to me. Honestly, I have always been a laid back girl when it came to fitness. But the best part about brisk walking is that anyone can do it with the least amount of equipment. I barely do it for 15 to 20 minutes a day, and the results have been truly wonderful. I felt it gave me a break from my studies. It helped me clear my head, and also it felt really refreshing. Eventually, it is not just about fitness but also about feeling good. Personally, I saw stability in my weight, and it helped me to elevate my mood the whole day. But these benefits are visible only with a consistent practice of a month. Um, so consistency is key, not only for brisk walking but for any physical exercise if one wants to see the positive effects of the same. Thank you.